Hi, I'm Bendok from the Department of Neurosurgery at Mayo Clinic in Arizona.
Hi, my name is Jamal McClendon. I'm also a member of the Department of Neurosurgery at Mayo Clinic in Arizona.
I'm really proud to be here today with Dr. McClendon. Dr. McClendon is the head of our scoliosis program. Scoliosis is a very important and occasionally debilitating disease that has great solutions these days. So I'm really proud and honored to be here to engage Dr. McClendon in a discussion, a bit of an interview, so to speak. So, Dr. McClendon, tell us how you got interested in scoliosis. What led you to really be so passionate about this important area of healthcare?
Well, thank you, Dr. Bendok. I always get very delighted to have the opportunity to speak on scoliosis and management of curvatures of the spine. I initially became interested in scoliosis and management of patients with spine and spinal disorders from great mentors that I had. These were mentors that during residency really amplified and really embodied what it meant to be part of a full to be able to care for patients who are really struggling with scoliosis and deformity and degenerative changes within the spine, and their ability to be able to help and comfort these patients, irrespective of whether a surgical intervention was needed or not. Their ability to be able to be fully involved in their care was something that really struck home to me.
Along those lines, I've seen how you've made such a big difference in many people's lives. What's one story you'd like to share with the audience about how maybe perhaps a patient that you helped, a story that stands out at Mayo Clinic where you were able to really turn somebody's life around in a meaningful way?
Yeah, so a lot of times these surgeries that if a patient does see us in the clinic and they do demonstrate signs and do have a physical examination such that it is concerning that they may benefit from a surgical intervention, we oftentimes spend a significant amount of time getting to know them, not necessarily just themselves, but also their family, their social situation, and really them actually becoming members of our family. The amount of testing that we utilize to be able to educate them regarding their overall safety within the operation, and then also to minimize complications furthermore highlights to the point where we really get to know them extensively. Following a surgical intervention, their routine follow-ups, their imaging that's done, the amount of time and care that is spent with them, we really treat them as if they are family. I can think of a couple examples where there was a family locally within the valley that spent some time not only necessarily in the valley but also in the Boston area, and so the patient had seen a second opinion who I referred to some of my colleagues in the Boston area, and then ultimately came back and had surgery here. And just getting to know them, their family, their extended family, being able to provide a surgery for them at Mayo Clinic, Arizona, and then participating in the Mayo Clinic rehab program, and then seeing them in follow-up and really having a very nice result. It really means a lot. Oftentimes, because we get to know them, patients are extremely appreciative, whether it's a hug in the clinic or sometimes just gifts for the staff. The patients, we really have a great opportunity to really help them and really change their lives. And these surgeries oftentimes are life-changing.
I attended your session today on scoliosis, and we're here in Sedona for our first annual neuroscience update, or a neuroscience symposium. And the session on scoliosis was fantastic, and I really learned a lot. One of the messages from that session was that not everybody with scoliosis needs surgery. So who should be getting a surgical opinion? Who needs surgery for scoliosis, and who is better managed conservatively?
Yeah, so oftentimes when I would see a patient as a spinal surgeon, when I see a patient in the clinic, it's oftentimes being referred from a primary provider or a primary internist who sees the patient. Typically, it's for the adult patient, it's oftentimes from some aspect of pain. And based on an aspect of pain, them having a diagnosis of a curvature of a spine based on a plain film, they're oftentimes referred to our office. So a pain manifestation and a radiologic suggestion of a curvature of the spine oftentimes generates a referral. So anybody where there's a question or just an additional insight or a second look that's something we're always happy to see that patient. For the adolescent, oftentimes it comes when either a family member or coach or for a sports physical, we are able to identify an asymmetry, whether it's in the waist or within the shoulders, or there's their clothes just fit a little bit differently, is how sometimes we first discover this. The curvatures of the spine or the scoliosis. So it varies kind of based on age, but you're absolutely right. The majority of patients absolutely do not need a surgery, and we typically would follow them over time, and that if they do have a curvature of the spine, we'll just want to make sure that there's no concern for a progression.
You know, my perception, having watched the field throughout my career, is that the outcomes have improved over the last 20 years. What would you say are the two or three factors that have resulted in that improvement?
Yeah. I think there's a part of it has to do with a learning curve. When people were first starting to tackle the challenges of curvatures of the spine, thinking about ways to actually approach the spine have evolved over the years. Yeah. Now, as the technical proficiency has increased, patient outcomes have increased as well. We're also starting to look at our patient-reported outcomes and seeing what has worked, what has not worked, and seeing if we can actually modify some of our techniques based on the patient's reported outcomes that they have. A big push within the Scoliosis Research Society is evaluating patients, not necessarily just on their initial post-op visit, but at least 2 years, and more importantly, now 5-year outcome is now starting to be the minimum.
So you study your results.
Yeah, and it's the short term is being considered 5 years nowadays.
What about the exciting field of minimally invasive spine surgery? What impact has that had on outcomes and techniques in scoliosis surgery, the minimally invasive approaches?
Well, I think the minimally invasive techniques, the innovation within treatment for scoliosis has actually caused a lot of surgeons who do spine surgery to look at other options or other alternatives for very traditional approaches. The overall goal of a scoliosis, particularly in the adolescent, is to stop the progression of the growth and to obtain a solid fusion. For the adult, it's to address the degenerative issue, help with the back pain and any of the leg pain or possible neurologic deficit. Keeping those goals in mind, if there's a minimally invasive approach that can accomplish that, even despite radiographic appreciation may look 50% okay, that potentially is better than perfection. And what's going to be very important is that as we study these 2 and 5 year outcomes, knowing that the minimally invasive approach is equipoise or does not show inferiority, I think we'll start to see a shift in the paradigm towards more minimally invasive approaches.
Now, so if I'm a parent of a child or young adult with scoliosis, or if I myself I'm a young person with scoliosis, I can imagine that has a psychological toll. You know, what does it mean? How will that impact my life? Will it, what will that do to my future? What message would you have for somebody right now who just learned they had scoliosis, and I having watched your practice, I sense the message of hope has increased, and what message would you have, or what would you want them to know? Sometimes knowledge can alleviate fear, and what would you say to that person?
I think the biggest thing is education. Them having the opportunity to have access to very experienced people who know a significant amount about their condition, being able to speak to the natural history of their condition, and then also being able to talk about what options there are, having an understanding that there is a multitude of options for patients who do learn about the diagnosis of scoliosis is very important because we can provide that education for them to know what the next steps for as far as living the rest of their life.
One of the amazing things you've done is bridge that gap between our colleagues at the Phoenix Children's Hospital and Mayo Clinic. And to me, I'm not a spine expert, but I sense that is a very important element in the overall management of patients with scoliosis. Could you comment on that and how that collaboration with our colleagues, Dr. David Adelson and his colleagues at Children's, and that collaboration?
Well, historically, we've seen a lot as far as management, as far as scoliosis for the child. Traditionally, it's been mostly the orthopedic surgeon that has cared for the patient with scoliosis who is an adolescent or even the early onset type. I've been very fortunate to have the opportunity not only to work with orthopedic surgery colleagues and part of my training, but in addition to pediatric neurosurgery colleagues as well as far as training, but to be able to kind of have a symbiosis and a kind of a marriage between not only orthopedic surgery but pediatric neurosurgery, and to the point in which it's something that I have a kind of an innate desire to really want to help not only children but also children lifelong, because when I think about outcomes in the next evolutions of how we think about the care for the child, the big push within the research society is, again, not necessarily just looking at the 2-year outcome, but 5 years down the line. And there can be changes that can happen within the adolescent that then can develop within the adult. And so limiting a patient just to a specific age group has always been a challenge for me. So I think that what we have is a great opportunity here at Mayo Clinic, Arizona. We've developed a fantastic relationship, what I think is very special and is in my opinion, the most unique within the country, that fosters a relationship with the pediatric neurosurgery team, fosters a significant relationship with the orthopedic surgery team, and the collaboration there is second to none.
What I find amazing about your training and background is that you trained in adult spine surgery, then you went on to do a fellowship. You did actually a fellowship with a neurosurgeon who does scoliosis, and then you went on to do a fellowship with orthopedic surgeons who treat scoliosis. So you got to see the different perspectives and the various techniques and so on. And then to bridge the next gap, you went on to do a fellowship with Dr. David Adelson at Children's, and so you have a very unique. I would imagine that there are not many people in the world who have had that diverse training. And could you comment on that? I know you're a very humble person, but how that could be an asset to a family member or a patient with scoliosis or a family that is seeking care for scoliosis.
Sure. Yeah, no, I've been very fortunate to be able to have a pathway that allows me to be able to take care of not only adults but also children. A big passion of mine is to take care of both populations, and as I mentioned, spinal disorders in all ages. It's something that I've had a passion for a very, very long time, and so I think that when my interaction with patients in the clinic and meeting them in the inpatient ward, I think they get a general sense that the overall desire is 100% the care for that particular patient. And I think that with the team that we have, the team of experts that we have, both at Mayo Clinic, Arizona, and also our team of experts that cross disciplines at Phoenix Children's Hospital, the patients get that knowledge that I'm able to provide them, and I think they make a very nice informed decision regarding the next steps in their care based on that.
One of the questions I hear occasionally is the why. Why did I get scoliosis? What do we know now about the origins, causes, and I know there's more than one, of why do people get scoliosis?
It's a current discussion amongst several members within the Scoliosis Research Society. It's multifactorial. It is known that there are genetic components that are related to patients developing a curvature of their spine. There is a thought that there's a muscle imbalance that is also present that creates an asymmetry. It's also thought that muscle imbalance or potentially a connective tissue pathology is a driver of patients developing a worsening of a curvature. It's thought to be multifactorial.
Yes.
But there is a genetic component for some of the scoliosis, particularly the idiopathic type.
Tell us your views on the future. I mean, technology is advancing quickly. Which technologies and which future directions are you most excited about in this field?
Sure. So for the, I think for the child, the very exciting aspect is just, I think it relates to education. I think diagnosing patients earlier, involving family members earlier, having detailed discussions, I think is the most exciting portion. The technology is such.
Before you go on to that, may I ask, so along that, you bring up a fascinating point. What should families ask their pediatrician for spine health? What would you say would be one? Is there one test or one question, or is it just the physical exam? What would you say to that?
I would say, repeat that one.
I'm sorry. So you were just talking about earlier diagnosis.
Mm-hmm.
Presumably, there's some cases that are not diagnosed till later.
Mm-hmm.
What can families of children perhaps ask their pediatrician to look out for, or what do pediatricians look for to perhaps avoid that issue of delayed diagnosis?
Sure. Some of that has to do with just asking them, do they know any differences of how their clothes fit, or do they notice any asymmetry when they're using the bathroom, or if there's if they notice their child their back appears asymmetric. Just kind of some general health questions.
Yeah.
Being a little bit more proactive.
Yes.
I think is.
Or maybe performance in gym class at school. Yeah. So, okay. And then you were saying about the technology and.
Yeah. So the technology is such that we've seen a rapid development in the technology, particularly over the last 5 to 10 years. Particularly as far as being able to move the spine in kind of the direction we want to get it a correction. But I think the more fascinating aspect, particularly for the adolescent, is the overall the continuum of care, and then what we have done. How is that going to impact them 20 and 30 years? I think that's more exciting as far as the adolescent than the actual the newer innovations as far as instrumentation and equipment. For the adult, I think what I think is most pressing is all that is being known and being done within the spine world and the spine community for scoliosis. Is it effective? Is what we potentially propose the best solution for them? And I think that's the more exciting piece as it relates to how do we approach this particular condition.
Got it. So, as patients and families look for centers of excellence for scoliosis, and you've done a marvelous job just in a couple years building the groundwork towards a incredible center of excellence. And from what I see, the interaction across the Mayo enterprise, meaning Mayo Florida, Mayo Rochester, and Mayo Arizona, working together to enhance spine care, and then your relationship with Phoenix Children's and Dr. David Adelson and his group to take spine care in Arizona to the next level. It's been just fun for me to watch and really inspiring. What would you say if a family is researching where they should take their loved one, or if a patient's researching for themselves where they should go? What are the characteristics of a center of excellence that you think they should be looking for?
Sure. I think that comes down to experience and essentially the knowledge base that a provider has. At the Mayo Clinic, we have 3 different sites, and each of these different sites has spinal surgeons who have done extensive fellowship training, not only in minimally invasive surgery, but also for deformity surgery as well. These surgeons have been involved in fellowships that are premier international fellowships and are recognized within the Scoliosis Research Society as the most premier fellowships, and we have that within our Mayo system. And that's something that's very special that not a whole lot of centers have, which is something that we can articulate and tell families. When a family asks me, why would you consider having your care at one particular institution versus another, a lot of that has to do with reputation. It has to do with not only their clinical reputation, but also the research that you provide and being able to actually study your patients and know that whatever you offer them, you're going to be able to potentially help them. But it's also trying to push the envelope and looking for new frontiers of treatment, whether it's from a basic science research for understanding natural history, or it's for clinical research and trying to identify different ways of approaching a similar problem, or trying to study how something progresses over time. We're looking for long-term outcomes of biomechanics. I think that patients want to see an evolution or a progression, just like when you people have an expectation as a consumer that within 5 to 10 years we know that there's going to be a newer technology as far as a telephone. Patients want to know that that a surgeon or a provider is continuing to learn, such that there may be newer,
and innovate.
And there are newer innovations that are present, and they're part of that innovation and trying to learn to be able to better take care of patients.
Well, this has been a wonderful time to sit down with you, Dr. McClendon, and really hear about the current state and the future of scoliosis. I learned a lot from your symposium today, and the message I'm taking away from today is today there's more hope than ever for patients with scoliosis, patients with complex spinal disorders. Thank you for all the great work you're doing to help advance the field. I'm very proud to be your chair and to work with you at Mayo Clinic in Arizona, and I look forward to what I know is going to be an amazing career for you here at Mayo and at Phoenix Children's. And this is a great time. There's a great hope, I would say, for patients with scoliosis. And for those of you out there who have been diagnosed with scoliosis, please know that we are working hard to advance the field, to create more hope, more innovations, more solutions, and we wish you the best. Thank you.
Thank you.